We are now completely living in the aging society due to an increasing number of senior citizens amidst a declining number of world's population. However, caring the elderly and patient has turned into a concern to many people, but actually giving them a care with love and understanding could make things get easier. For the elderly, we should put a focus on both mental and physical care so that they would have a better quality of life under an accurate and appropriate practice.
怎么样呢？您好起来了吗？现在感觉怎么样？
The Department of Skill Development Ministry of Labor has provided a course of nursing assistant for elderly and basic care for patients so that they could apply knowledge and skill to those who need assistance in family or community. Moreover, it could be applied to access career path for the elderly nursing care business, including a preparation for labor and skill test. To those who would like to apply the skilled job in overseas market, according to the course of nursing assistant for elderly and basic care for patient, it required 180 hours training course, including a test to evaluate the performance. The successful trainees will get a certificate from the Department of Skill Development. The curriculum has included the following subject. 1. Important for the elderly nursing care. It is necessary to study physical, mental, and emotional change, including society, medical welfare, caring with understanding, and willing to listen to their problem and needs. 2. A right of elderly guaranteed by the Constitution and labor law. Following are significant law to guarantee the right of elderly, which are the current Constitution, BE 2553, Elderly Law, BE 2546, Labor Law involved with the elderly, Service Care at Home, BE 2553, and Occupation Law, Overseas Working and a Right of Elderly. 3. Basic Communication for Elderly Nursing Care. It is involved the basic language used for integrated elderly nursing care. 4. Roles and Ethics for Elderly Caretaker. It studies the scope of roles and ethics for caretakers, how to self-take care, relax from any stress that might occur from the job, a requirement from elderly and caretaker, violence defense, and family and law related with elderly and caretaker. 5. Cross-cultural caring. The concept of caring emphasizes on caring. Human care theory, roles of cross-cultural caretaker. 6. A concept of elderly. It has included a theory of elderly, physical and psychological theory, social elderly theory, physical, mental, and social change in the old age, frequently found symptoms. 7. Integrated elderly assessment principle. It trains about life pulse measurement, evaluates capacity of daily life performance, personal history inquiry, basic physical checkup, depression screening, Alzheimer's disease basic test. 8. Nursing care to the elderly living with frequently found diseases. It studies and practices how to take care of those who are sick with frequently found diseases and their mental health problems. 9. Crisis incidents and first aid treatment. First aid treatment is trained to save the elderly's life, including basic PCR. 10. Assist to disabled elderly. It studies and trains how to clean body, tube insert, wounded elderly, urinary tube care, and elderly living with life support machine. 11. Health promotion for the elderly. It learns about food nutrition, exercise, healing by nature, mental change, recreational activity, local wisdom for healthcare, vaccination, and violence prevention. 12. Safe environment management to the elderly. It studies and practices on how to provide safely environment for them. It is very important to consider a factor of physical change for a proper indoor and outdoor landscape management, including other related factors. 13. Medical use for the elderly. It needs to study basic use drug and side effects, including antibiotic drug in the elderly. 14. A preparation for the last stage of life. It studies about the living will, letter to intention, and mental care before the last stage of life. 15. Training experience for elderly care. It is divided into 3 groups. Firstly, the group who could depend on him, or herself. Secondary, the group who could partly rely on him or herself. And lastly, the disabled people. 16. For evaluation, the trainee is required to pass both writing examination and practicing tests. We have already trained over 300 people who have fulfilled excellent skill of elderly nursing care. It has been certified by the Department of Skill Development, Ministry of Labor.
For a healthy and happy life to the elderly who is beloved for a family.
Besides confidence given to the elderly and patients, our service from all of us is done based on mental health as well. You can trust to get a person who is qualified with knowledge, ethics, and professional, and ready to do the job as the caretaker for the elderly and patients.